All right, good morning or good afternoon to everyone from MWG Senior Services. This is going to be a brief tutorial on the basics of Medicare. This will not encompass every detail there is to know about Medicare, so if that's what you're looking for, I would highly recommend you read the Medicare and You booklet or choosing a Medigap policy booklet. They both have a lot of great detailed information. You can also go to MedicareInsuranceFinders.com or MedicareInsuranceFinders.com/blog. Those are some of our websites we put up to be able to help people with general information on Medicare. We also have a ask and reply section where you can post comments that you have, and we'll be able to get back to you that way as well. Also, you can always contact us. Let's get started. We're going to be going over again the basics of Medicare. Before we get started, kind of want to just talk a little bit about Morgan White Group, let you know who you're working with. We were formed in 1987, been in the business over 25 years. We formed our senior division. We were primarily group health insurance. When Medicare Part D came out, we realized we need to be able to help people. There was a need there. And so we started a retail focus. Now we're handling every angle just about of Medicare supplements, from the wholesale, recruiting brokers and contracting underneath us, providing them with tools such as the Medicare Supplement quote engine, other different things like the batch quote, marketing materials that a lot of agencies don't have the ability to provide. We are providing that to our downline agents. We also still handle retail. We have thousands of clients. We work in about 47 states. We provide brokers who don't want to work the business, who want to refer it. We have an option for them. And then we also handle group Medicare supplements. MWG Awards, we're the top 10 most dependable insurance agencies in the country several years in a row. We're top 100 private companies in Mississippi the past 7 years. Inc. Magazine, we've been in the top 50 fastest growing insurance agencies the past 2 years, with top 30 this year. We've been endorsed by several different associations and the Mississippi Senior Council. Next, I want to move on to what Medicare Part A is. Let's get it kicked off and get this thing rolling. It'll be about 10 minutes, hopefully, total. Part A helps cover inpatient care in hospitals, at least if you're there overnight. Helps cover skilled nursing facility, hospice, and home health care with certain requirements. What we're talking about here is if you've been in the hospital 3 days, then you could be admitted to a skilled nursing facility and it be covered by Medicare. The Part A deductible for the benefit period, not annual deductible, but benefit period is $1,184 in 2013. The benefit period is the time frame that begins the first day a patient stays overnight in the hospital and continues until the patient has been out of the hospital for 60 consecutive days. The benefit period, example of this, let's say you go into the hospital January 1st, you're there for 5 days. There's a $1,184 deductible for this benefit period. In April, you go back, a new benefit period or another $1,184 is required because you're in a different period. It's not an annual deductible, it is a benefit period. Most people get Medicare Part A for free. If you've worked 40 quarters or 10 years of working, there's no Part A cost. So this is a good thing to know. However, the premium hits you pretty good if you have not worked this amount. You can see that there. Know the Part A trust fund is still losing money on this, so it really should be higher than it is. So Part A is free for probably 95% of the people out there. Medicare Part B, medical insurance, covers doctors' services, outpatient services, certain home health services, durable medical equipment, physical therapy, speech therapy, different things of this nature. It covers some preventative services as well that kind of just helps you kind of keep everything going and kick it in the right way. Cardiovascular screenings, colon cancer screenings, diabetes tests, EKG screenings, flu shots, glaucoma tests, and there's a whole list of them. And again, as I mentioned earlier, the Medicare You booklet has a total list of these. This is just to give you a general overview and so you can be able to talk to people about it. You don't have to give them every preventative service that's covered. There's about 3 or 4 pages of how it's defined in there. You don't need to know that. Just know the basics to be able to help your clients out. The Part B annual deductible in 2013 is $147. There is a monthly premium as well. We'll go over that in just a minute. Know this Part B deductible changes every year. It's bounced around some over the past few years. You can see in 2008 it was $135, 2010 it was $155, 2011 $162, and now it's down to $147. And that is the deductible. And there's still a 20% co-insurance. You hear the 80-20 rule with Medicare a lot. This is where it kind of applies. Premium. Part B premium right now will be $104.90. for the Part B premium. If you are a normal income earner, if you're an individual under $85,000, or if you're a couple under $170,000. However, I've asked in different presentations we've done across the country, when does your premium start going up? The normal individual respond, well, if you're a high income earner at $250,000. Well, it's not exactly like that. You will see here there are different income limits, $85,000 to $107,000 for individuals, then $107 to $160, the $160 to $214, $214 plus. So you have 5 different levels of income here, and you can see that if you're in the high income level, that $335.70 is a pretty high premium to be paying each month. So it's important you do not want to switch your clients from a group health plan to this if they are a high income earner most of the time, because they'll have this premium. They also have the Part D high premium, which you can see over the right. So your Part B and your Part B penalty together alone are just $400 if you're a high income earner, the highest bracket, not including what your Part D is, and then not including what your Medicare Supplement is as well. So it can get on up there. It's something you just need to evaluate. That's a little extra. 2 types of supplemental insurance. There's Medicare Supplements, Medigap plans, and there's Medicare Advantage plans. Medicare Supplements fill in the gaps of Part A and Part B. They're filling the gaps of original Medicare. Part C plans take over the original Medicare coverage. They're not going to provide as good a coverage as Medicare Supplements. However, they don't cost as much normally. Coverage is required to be at least as good, if not better, than original Medicare alone. They have networks, deductibles, copays, coinsurance. It's very similar to Medicare. We compare it to a group health plan, but with less providers in the network. Medigap policies. They fill in the gaps of original Medicare. You can watch our Medicare Supplement Insurance video. It's a little training guide we have for brokers. Then you see we have plans, Medicare has plans A through N. Now there's not the 15, 16 plans, whatever that is. There's only 10 plans, 11 if you include the high deductible plan F. It's the only high deductible Medicare supplement there is. And as you'll see here, each standardized Medigap policy must offer the same basic benefits no matter which insurance company sells it. Cost is usually the only difference between Medigap policies sold with the same letter. This is a good thing to know that a Mutual of Omaha and AARP Plan F have the same benefits. There's no difference but the premium and financial stability. One thing that's good to check is loss ratios if you can. However, if you're not doing business in a lot of states, you won't know kind of how they're getting impacted. It's good to kind of see what they're doing in other places as well. That is one thing that we can help out on. This is what our quote engine looks like for quoting Medicare supplements. We provide this to brokers with links and website quoters and iframes and the different ways to be able to quote. You can see the different carriers listed on the left. It's sorted by monthly bank draft, whichever's the lowest. You can sort by different ways, by invest rating, sort by different plans, and then you'll see there that you have household rates with some of the carriers. This is what the quote engine looks like. The easiest way to quote Medicare supplements, you get a quote in less than 2 minutes every time. A lot of times less than 30 seconds. You can quote in any state across the country. Medicare Part C. These are Medicare Advantage plans. Again, as we mentioned earlier, these are run by private insurance companies and approved by Medicare. They are a Part C plan. They're not a Plan C, they're Part C. They include Part A and Part B and usually other coverage such as prescription drugs. Some carriers provide additional benefits along with that. You can see dental, vision, gym memberships. Humana is known for their gym membership, and a lot of seniors are really like that. Different types of Medicare Advantage plans. There's PPOs, HMOs, PFFS, MSA, and SMP. We're not going to cover all the basics of those. You want to sell Medicare Advantage or Part D plans, know that you have to be AHIP certified. That is a certification you have to take. You will have to take each company certification, but then you also have to take the national AHIP certification as well. These can be a good thing to have in your portfolio for some people. We in our quote engine do Medicare supplements. We also have Medicare Advantage plans in our state, but we don't do them across the country. Some Mississippi Medicare plan information. I'm not going to cover that. Medicare Part C. Medicare Supplement has less cost sharing, if any. Medicare Advantage plans have more cost sharing. Medicare Supplements have higher premiums. MAs have lower premiums. Medicare Supplements cannot include Part D where Medicare Advantage plans can include Part D. Benefits stay the same. Medicare Supplements plans change every year with the Medicare Advantage plan. All Medicare providers are included under Medicare Supplement, or Medicare Advantage has certain networks. Safer, more secure plans, Medicare Supplements. Medicare Advantage plans taking more risk. What is Medicare Part D? It took effect in January. Sorry, I kind of rolled real quickly. Medicare Part D is a prescription drug plan. Took effect in 2006. It covers the cost of prescription drugs. It does not pick up all the cost of your prescriptions. You will have co-pays and co-insurances along with those plans. Premiums vary based on the number of drugs you take, formulary, drug limitations, co-pays, deductibles. And let me make this clear. Premiums vary based on these factors. If you can choose a $15 plan, $20 plan, whatever it is, no matter how many drugs you have. Just all your drugs may not be covered. They may not have the best co-pays, co-insurance. The best way to do this, I know a lot of people don't like to do this, but this is the best way, is to go to Medicare.gov, look them up, find out which plans are the best. If you got the plan, enroll. If not, help them out online. There's different things you can do that way. We don't do any Part D enrollments where they're not our Medicare Supplement client, so we're very clear on that. And show you an example, 2013, there's 29 Part D plans in Mississippi. Premiums range from $15 to $112. All cover difference. And for a lot of people, the $15 plan is the best plan. And for disclosure, you're not allowed to say the best plan to a client. You should. We use the word the most cost-effective plan because we look it up by cost. This is the plan design on how Part D plans work. This will change a little bit each year. That deductible slightly goes up each year. It's a $325 initial coverage limit. Then you have the out-of-pocket of up to $4,750. This is the donut hole coverage gap area. Now you're only going to pay 47.5% of your drugs cost during the donut hole, where at one point you're having to pay 100%. That's slowly started covering, and by 2020 the donut hole will be eliminated. Catastrophic coverage, $4,750. When you hit that mark of what your total out-of-pocket cost has been, then you'll have lower co-pays, 5% or $5 of the drug cost, or $5 or 5% of the drug cost. Part D enrollment periods. You got the annual election period. This is the time most people are familiar with when they can change plans each year. You get the Medicare Advantage disenrollment period, January 1st through February 14th. You get a special election period, which is situational. This is if you're coming off a group health plan or something of this nature. Enrollment in Medigap plan is year-round as well, as long as you qualify physically. So Medicare Advantage plans you can only enroll certain times. Part D plans you can only enroll certain times. Medigap plans you can change or switch those anytime as long as you can qualify and answer health questions. Things Medicare does not cover. Medicare doesn't cover everything. Even if it does cover a service, there are often out-of-pocket costs, deductibles, co-insurance, etc., unless you have other insurance. Long-term care, routine dental care, dentures, blah, blah, blah. You'll see the list, cosmetic surgery. These are the things that Medicare does not cover. I'm sorry, I'm trying to speed this up and make sure we're done in the total 15 minutes. There we go. That was my last slide. But we thank you for coming and listening to the Medicare Basics presentation. We have other videos. You can go to YouTube. You can go to MedicareInsuranceFinders.com. There's a lot of information. But we appreciate you. I hope to be able to provide you with your Medicare Supplement insurance services. We also handle a lot of dental, vision, and other group products as well. So thank you for attending our webinar today.